Hola, ¿qué tal? Soy la doctora Cynthia Aguayo y en el episodio de hoy de Zona Saludable vamos a tener una invitada súper especial. Es farmacóloga del estado de Texas, así que la entrevista que haremos el día de hoy sería en inglés, pero para su comodidad va a tener subtítulos en español. Espero les guste mucho. Welcome to another episode of Zona Saludable. I'm your host, Dr. Cynthia Aguayo, and today we have a very special guest. She is one of the most important and smartest women in my life. She's not only beautiful from the outside, she's also beautiful from the inside. And I'm proud to say that she's my cousin. I'm talking about Josie Meza. She's a pharmacologist here in the state of Texas.
No, thank you for having me.
Before we get started with our main topic, could you please let us know a little bit about your academic background? Where did you go to school? How many years did it take you to become a pharmacologist? And what exactly does your job entail?
Yes. So I graduated from the University of Texas at El Paso School of Pharmacy. Mm-hmm. The program in itself is 4 years long, but it does require 2 years of prerequisite courses, which as a full-time undergraduate student takes around 2 years to complete. I have been working in a community pharmacy for the past 3 years. Some of the common disease states that you see in a community pharmacy are actually a little bit of everything, but if I would have to pick 5 most common disease states that I see are diabetes, high blood pressure, high cholesterol, lung diseases, and infections.
One of the main reasons that the patients will seek medical help is when they have an infection. And sometimes the patient will think that an antibiotic is the right treatment for them, but that is not always the case. What are the most common symptoms of an infection, and what type of organism can cause an infection?
Some of the most common symptoms that a patient will present include fever, pain, inflammation, any body secretions that might be different in color. They're green, yellow, red. So whenever patients have these symptoms, and a true infection might be present, but we still have to keep in mind that there's different types of infections that exist. There's bacterial, viral infections, parasitic, and fungi. Mm-hmm. So the answer won't always be necessarily to start an antibiotic, since antibiotics will only treat one of these 4 causes. For this reason, it's always important to go to a medical physician to clarify what type of infection they have before starting to self-treat.
How do you identify a bacterial infection?
So there's different types of tests that exist. The first step is always to identify that a true infection is present. The way that we do this is by identifying patient symptoms as well as following their laboratory markers, such as elevated white blood cell counts. There's also specific tests that we can perform. For example, the gram stain testing that identifies bacteria in body fluids. Another tests are rapid diagnostic techniques, which will identify the pathogen that's present in the matter of minutes. Nowadays, nucleic acid amplification methods are very common to be seen. What they'll do is copy DNA strands and replicate them in order to identify, again, the pathogen that needs to be treated.
Why do some doctors usually prescribe a medication without running any diagnostic tests?
The reason behind this is because delaying the course of therapy for patients can cause an increase in morbidity and mortality for patients. So we also have to keep in mind that some of these tests can take up to 5 days to identify the pathogen, because that's just the rate at which the organisms can grow.
So what are some of the reasons that an antibiotic therapy fails?
The first reason could be because the incorrect organism was identified. Another reason could be because we're using the wrong agent to treat the infection, or we're using it at the wrong dose. Another reason could be antimicrobial resistance, which is one of the main public health concerns from the 21st century. There's 4 types of antibiotic resistance that exist. The first one is intrinsic resistance, which is when from the beginning, the antibiotic doesn't have any activity against an organism. The second one is selection pressure, where an antibiotic has activity against sensitive bacteria, but it leaves behind resistant bacteria, which can then outnumber and keep growing. Mm-hmm. The third one is acquired resistance, where an antibiotic at the beginning had activity against the organism, but over time the organism changes. Therefore, agent doesn't have any effect on it anymore. And the last one is enzymatic resistance, which is when the organism produces enzymes that'll target and inactivate the antibiotic in order for it to stop working.
What are some of the consequences of acquiring resistance to antibiotics?
We start having less and less options to treat them. This can lead to increased hospital stays, increased healthcare costs, frequent follow-up visits with their doctors, increased side effects from stronger medications that we have to start using.
How do health organizations keep up with the cases of patients who have acquired resistance to antibiotics?
Many institutions have developed an antimicrobial resistance program. This group mainly consists of a multidisciplinary team, including microbiology representation, nurses, clinical pharmacists are specialized in infectious diseases, and doctors from various specialties.
See, I think it's one of my favorite questions, and I really want to hear your thoughts about it. What's your intake on patients, family, and friends that share medication, especially antibiotics, between them? I know it's pretty common among our Latino community. What do you think about that?
Especially living in a border town city, we often see patients going to their friends or family before going to see their doctor. We also see a lot of patients who have more than one primary health provider in El Paso and in Ciudad Juarez. What we also see here is trends of polypharmacy, which is where patients take 5 or more medications on a regular basis. And sometimes we'll find that some of these medications aren't even clinically appropriate for them. So I do not recommend sharing medications just because there's a lot of moving parts when it comes to prescribing a medication. There's also other things to watch out for. Medications could be expired. They could be accidentally mixed. We don't know what the other person's medication regimen is like.
So basically they're specific to that patient, right?
Yes.
See, how can a patient prevent an infection?
Best way to answer this question, I believe, is to go over how infections are transmitted. Some of the common routes of transmission include air transmission, droplet transmission, there are sexually transmitted diseases, transmission through contaminated food or water, or recently being hospitalized. The ways to prevent infection include social distancing, wearing face masks, and avoiding contact with other people's body fluids.
See, to finalize this interview, is there any other final thoughts that you would like to add?
Yes, I've discovered throughout my journey that the goal is not to medicate all patients. On the contrary, there's a lot of times when lifestyle modifications are just enough, though I strongly recommend for patients to seek medical attention before starting any medication. I also recommend for patients to keep a list of all of their prescribed medications, vitamins, supplements, and even vaccines, just to make those transitions of care a little bit smoother between healthcare providers.
Thank you so much, Sir Josie, for telling us a little bit more about infections and antibiotics. And remember that it's very important when you have an infection to seek the help of a specialist such as our guest. And if you have any further questions for my guest or myself, please feel free to write us. And I hope to see you on the next episode of Zona Saludable. I'm your host, Dr. Cynthia Aguayo. Have a great day.